Sawadee and good afternoon once again. I'll provide the English language summary for the press briefing that we had just now at the Center for COVID Situation Administration, or the CCSA. Today is Sunday, April the 19th, 2020. First of all, we'd like to thank the people, for the general public, for the cooperation with the government measures in fighting against COVID. And many people now have taken it in as a very frequent habit to wear masks and practice social distancing. And of course, this will not only save your lives, but those of others as well. And of course, wearing masks is now already accepted around the world abroad as an important practice. However, since the situation may seem to have improved, we have seen more vehicles, more cars on the roads in Bangkok and perhaps in other areas in the country during the daytime, and there have been traffic jams actually in some points. I should also like to remind you that we have done far so well, but we are not out of the danger zone yet. And it may be worrying that some seem to be lowering their guard, which could provide an opportunity for the virus to rebound. Therefore, we must continue to keep our guard up and keep our guard high. Last night, His Excellency the Prime Minister, as director of the CCSA, visited some local checkpoints around Bangkok, such as in the Thonglaw, Payathai, Patumwan, and other areas. And he expressed his thanks, his appreciation to all the officers involved for their hard work and gave them words of moral support. And from this inspection, he also learned that the people have been very, very cooperative with the curfew hours. While this morning, His Excellency the Prime Minister visited Thammasat University, Rangsit campus in Pathum Thani province to check on the first hospital or field hospital for COVID-19 patients, which has been in operation since the 25th of March 2020. So in cooperation with Thammasat University Hospital, Sirirat Hospital, Rama Thipadi Hospital, King Chulalongkorn Memorial Hospital, and Wachira Phayaban Hospital, the hospital can accommodate patients with up to 308 beds, which help reduce the congestion in those 5 hospitals in the regular beds. And after this visit, the Prime Minister also continued on to visit some other checkpoints today, which is probably currently going on, other checkpoints today in the Don Mueang area of Bangkok. So turning to the general situation, the numbers and the measures which we report to you every day. Firstly is the number of new confirmed cases. Again, we have double-digit new confirmed cases, not triple-digit. So we have 32 recorded for today. The accumulated total is 2,765. As for the total number of recoveries or discharged, we have 1,928. So just doing some math, if we subtract the number of accumulated confirmed cases with the number of recoveries, perhaps we have around 790 in terms of those who are still being treated in hospitals, which is quite a good number as compared to the other points during this month. As for the fatalities, I have for you today another good number, which is our record is 0 fatalities, no fatalities, just like yesterday, making the accumulated total still remaining at a standstill at 47 fatalities, which is good news. As for the observations for the new cases and numbers, Bangkok remains the location where the existing cases have been found, followed by its neighboring provinces and tourist provinces. The spokesperson also mentioned about the issue of plasma. The donation of blood for plasma from those who have recovered has not reached yet over 100 persons yet. So we encourage those who have recovered from COVID to consider donating their blood for plasma for future research and development. And please contact the Thai Red Cross for this. In terms of the risk factors, still close contact with those who are infected with COVID is the number one risk factor, around 42%, as presented by the spokesperson in one of the charts just now, followed by risk factors from contact with those returning from abroad, and followed by working or visiting or staying in risk areas such as entertainment areas and the like. As for the enforcement side, the enforcement curfew, total number of curfew violations we have recorded for today 742 around the country. For warnings, 109, and charged in legal cases, 633. On the top 5 of list of provinces with the most number of violations remain provinces and cities like Bangkok, Chonburi, Pathum Thani, Nonthaburi, and Nakhon Ratchasima. So we'd like to ask for your continued cooperation with the authorities. In many cases, people who violate the curfew also violate other laws, such as in public alcohol drinking, violating the emergency decree measures, driving under the influence, or racing in public roads, gambling, drug offenses, and many other criminal offenses. So we continue to ask for your cooperation in taking a close, monitoring closely all of the events happening in your area. So moving on to the Thai nationals abroad repatriation, which was outlined by the spokesperson just now. For the scheduled repatriation flights for today, the 19th of April, and tomorrow, the 20th of April, by air in particular, there is a special flight arranged for 162 AFS students from the United States arriving at Utapao Airport this morning, as well as 2 more flights arriving today, bringing Thai nationals back from Europe and Bahrain, as shown on the screen here. And of course, as mentioned often, all of these returnees will be placed into the state quarantine system, mandatory state quarantine system for 14 days. The spokesperson also presented today a flowchart for those returning from abroad, meaning that for those who are to be screened upon their return, if there are any signs of risk, or any symptoms, they would be sent to the hospitals for treatment. And if not, they would be entering the state quarantine process, wherein there will be a process of screening and checking on their health from time to time and taking the appropriate actions. And while we join hands in fighting the disease, of course, the embassies and consulates abroad of Thailand continue to provide assistance to Thai nationals. And many have done a great length to ensure that the Thai repatriated people can make the flights and prepare care packages and meals for them to take on board. And many Thai nationals around the world still, of course, wish to come home. And we will do our best with regards to the situation within the country. This is, of course, what is happening for governments around the world as well in assisting their people abroad. The spokesperson also talked about the case of land border re-entry for the Thai nationals. The reopening of the land borders with neighboring countries since yesterday, 18th of April, is only for Thai nationals to return home. And currently there are a large number of Thai nationals who have registered with the Foreign Ministry and through the Thai Embassy and Consulates General, particularly in Malaysia, the Embassy in Kuala Lumpur and Consulates General in Penang, and already registered for repatriation back by land until the end of this month. The number registered we have is around 2,548. And as mentioned by the spokesperson, the border checkpoints, the 3 main border checkpoints between Malaysia and Thailand have been opened for a total of around 350 Thai nationals each day. And the embassy has arranged buses to transport this return for those who have already registered with the embassy to return through the border. For Malaysia in particular, we have a different number of repatriated persons for each day in the coming days and weeks, such as yesterday was 266, and today around 303 in the system. So each day is different, and the important point is to have the returns spaced out and not return at the same time in order to have the most effective screening process and quarantine process upon their return. And of course, prior to returning, they register to obtain the necessary documents with the embassy and consulate, and they have consented to be quarantined in local quarantine areas for 14 days. And of course, we continue to thank the missions abroad that we have, particularly for this day, the Royal Thai Embassy in Kuala Lumpur and the Royal Thai Consulate General in Penang for the care packages, the rice and all the essential goods distributed to the Thai persons all across Malaysia. And some of this has been sent through volunteers in Malaysia, through the volunteer network in Malaysia, to be able to reach the Thai citizens around that country. So just some additional points. Just general advice, as the spokesperson and the CCSA has always reminded every day, to wash your hands often. Always wear masks. That is recognized around the world already, that masks, the usage of masks is very important to keep physical and social distance. And as the rainy season is approaching, of course, there is the risk of the virus being able to live longer in cooler temperatures. So you need to seriously take precautions for yourself and your loved ones. More importantly, measures needed to implement are not only for preventing COVID at the moment, but also for hygiene, to stay healthy, for prevention of other diseases such as the common cold, influenza, pneumonia, dengue fever, which have always been seasonal diseases. So at the CCSA, we take this opportunity to once again thank the doctors and nurses, the medical personnel, for supporting the staff who have risked their lives and worked tirelessly to take care of those infected by COVID. We ask the general public to help ease their workload by practicing hygiene and preventive measures, keeping yourself safe and protecting yourself from any chance of infection. In summary, let's all help our superheroes in white gown, as mentioned often in Thai. And of course, this is for the English language audience and the foreign community in Thailand to take note as well. And in the many recent events and crises in Thailand, we have witnessed the demonstration of the true spirit of the Thai people and the strength of our country, which includes the acts of heroism, of kindness, of solidarity. So likewise, in times of crisis or COVID, there have been many people who have come out of their homes to help the less fortunate and those who are impacted by the crisis. I think we might have some images for you here. As a spokesperson mentioned also, many people have come out to share and give out food and supplies and care packages. Here you have some images of this happening around the country. Of course, we consider this noble action of good citizens. These acts of generosity are truly appreciative, and they too, of course, are our superheroes. And I mentioned that everyone can be superheroes, in quotations, simply just by performing your hygiene practices and maintaining the standards, and wearing masks and washing your hands, among others. And in doing so, you can help stop the spread of the virus, protect yourself, your family, your friends and loved ones, and support the community and save the country. So the anecdote on superhero actually is not new, and I repeat this in English for the English language audience. So let's all bring out the hero, the superhero in you, in yourselves, and together fight the COVID. เอามาร่วมปลุกความเป็นฮีโร่ในใจของคนไทย Let's be superheroes to help doctors who are already superheroes to protect your loved ones. มาเป็นซูเปอร์ฮีโร่เพื่อช่วยคุณหมอและปกป้องคนที่คุณรักกันนะครับ Thank you very much. Good afternoon. สวัสดีครับ
ครับกราบขอบพระคุณ